Hello everyone and welcome back. I hope everybody's doing good and well during application season and everything is going accordingly. So for the USMLE series, I want to go over high yield points that I've encountered and are often missed by some of the students I tutor, and things that I think you should for sure know for your Step 2 CK exam. I'll just kind of rattle them off here from my personal notes, and I would definitely know them or look into them if you don't know the topic or the point I'm trying to get across. They'll be short, so you can just watch them quickly, and they'll be a mix of subjects. Alrighty, so let's begin. What is the first thing you would want to check with any type of patient who has had a long seizure and they describe in the STEM that they've been on the floor for, let's say, 8 hours? So the first thing you'd want to check is creatine kinase. And I've seen this tested a lot of times, and it's just something they expect you to put together with seizure and immobility. And this is kind of a weirder one. What would you recommend to a patient who has hammer toes? So they'll describe this in the exam, and basically what you need to know is it starts conservatively, which may be something like changing the shoe so that they're, let's say, wider, so they don't crush the toes as much. You can add in extra padding, and then if that tries and it still bothers them, you could recommend surgery. Alright, so what if you have a patient with COPD, history of smoking, and now they also have signs of heart failure? What do you want to give them? So you want to give these patients O2 and IV diuretics. Moving on, what can you get with lichen sclerosus, a common association? So you can get cancer with lichen sclerosus, which is why we tend to treat it and monitor, and usually it's in the flavor of volvular squamous carcinoma. So if you want, go look up the relationship between lichen sclerosus and volvular squamous cell carcinoma. Now let's say you have a male who comes in and they have a white lesion on their tongue, but everything else in the exam is benign. They're essentially asymptomatic. So what you want to do for an asymptomatic white tongue lesion is get a biopsy, and you can also prescribe nystatin. We just want to make sure and rule out any type of cancer, and we can just start treating right away with nystatin. So what if you have a patient with IgG kappa levels that are increased and they're completely asymptomatic? So increased IgG kappa, no symptoms, that's MGUS. And let's say in another heme patient, you do a bone biopsy and a megakaryocyte shows up. What is one of your possible diagnoses you should consider? And that's essential thrombocytopenia. So look up a picture of a megakaryocyte and then read about essential thrombocytopenia. So what would your workup be for a pregnant patient who comes in and she has a UTI? So first you would get urinalysis, and then after that you would treat with amoxicillin. Moving on, what is a treatment? Let's say you have a patient who's been bedbound, they're in hospice, or they have cancer. So let's say a cancer patient with constipation, which you may see on either imaging or just clinically. So basically what you want to do for these cancer patients with constipation is get a barium or air enema. Okay. What if you have a patient with problems raising their arms and they describe an annoying cough that won't go away, and the labs give you increased eosinophils? This is eosinophilic granulomatosis with polyangiitis. And if you have a patient comes in from an injury or just elderly age, and you're doing the physical exam, and you push on their patella, and it moves upward or downward, and it reduces his pain. So let's say you pushed the patella on the femur, and then he instantly felt better. Consider patellofemoral syndrome. So this is one that you should know the exam finding. You should know the exam finding that if they get relief upon pushing up on the patella or down, that it's patellofemoral syndrome. You should consider it. Okay. This is sometimes a confusing one for students. What if you are breastfeeding and the question stem is leading to mastitis, so you know it has mastitis, so you think you know, okay, I know what the treatment answer is going to be, but then they end it with the baby has oral thrush. What medicine are you going to give? And that's dicloxacillin. Very specific for that one. Breastfeeding with mastitis, baby had thrush, give dicloxacillin. And let's say you have a patient of any age who's been in a wheelchair for a sustained amount of time. What, I guess, thing you need to watch out for immobile people in wheelchairs as far as nutrition or vitamin deficiencies, and that's vitamin D deficiency. People in wheelchairs often get vitamin D deficiency. This is a question that I specifically remember missing on one of my exams when I was preparing for step 2. So let's say that there's a female, they're in their mid-40s, and they've been having they're having weird periods, whether in time or consistency or in, the matter of blood. Basically, so hot flashes at 42, I know this is easy, you're thinking this patient has menopause, but the answer is still, first, get pregnancy test. Yes. Hot flashes in mid-40s, think about getting a pregnancy test. And let's say that there's a old man, and he comes to your office, and he just had a nephew, let's say a nephew or niece, move in, or some family member that's younger, and pretty much the old man just seems really off, and then he mentions about things missing, maybe they've been stolen. When you get this kind of vibe, the right answer is report elderly abuse. So it's usually set up as for elderly abuse, besides just the caretakers, or as an old person who just had a family member move in, and then since then they've been doing worse. And what if you have a young and healthy guy or girl, let's say 19 to 27, and they've been having a cough, and you do an x-ray and they have diffuse bilateral lymph infiltrates, but they're young and healthy, but they feel like they've been coughing a lot and they feel sick. So consider mycoplasma pneumonia. That's the walking pneumonia. All right, and let's say you do a study of 20,000 people, and you're asked essentially what would affect the study the most if of those 20,000 people, let's say 13 or some large number, 13,000 of the people die. So what invalidates this 20,000 person study if 13,000 of the people die? And that's intention to treat. Okay. And then what if you have a type of study where it's doing standard treatment, let's say in cardio drugs, and they're trying to test a new drug. And basically they have people on the standard treatment, they have people on the new drug, and the doctors and scientists just observe. That's a randomized control trial. Randomized control trial is usually standard treatment drug, a drug that you know of, or has even been around for 20 to 100 years, and then versus a new drug. So old drug versus new drug, then they just sit and observe what happens. That's a randomized controlled trial. Alrighty guys, that was about 15. I'll try to keep these bunched as 15. And as I'm tutoring students for step 2, I'll start kind of correlating with things I've missed, things they're missing, things I still find complicated, and things you should definitely know for your shelf in step 2. Alrighty, thank you very much.